I'm going to discuss mechanism of labor in breech presentation. The denominator is sacrum in breech presentation. So there are four positions in breech presentation: left sacro-anterior, right sacro-anterior, right sacro-posterior, and left sacro-posterior. The mechanism of labor in breech presentation takes place at three different places: at the level of the breech, at the level of the shoulder, and at the level of the head. At the level of the breech, it is bitrochanteric diameter, which is 10 centimeter. At the level of the shoulder, it is bisacromial diameter, which is 12 centimeter. And at the level of the head, it is suboccipitofrontal diameter, which is 10.5 centimeter. Let us discuss the mechanism of labor in left sacro-anterior. The left sacro-anterior, the engaging diameter is the bitrochanteric diameter, which lies in the oblique diameter of the pelvis. Okay. And the sacrum, which is the denominator, is facing the iliopubic eminence. With more contractions, the breech descends with more compaction. Compaction means increased flexion. And then as it touches the pelvic floor, it undergoes internal rotation, and this anterior buttock comes to lie behind the pubic symphysis, about 1/8 of a circle. Further contraction, the breech descends, and then the legs delivered, followed by the rest of the trunk, and it undergoes restitution. Following the restitution of the legs, next is the delivery of the shoulder. The shoulder engaging diameter is a bisacromial diameter that engages in the left oblique diameter of the pelvis. Okay. And this with contraction, it descends and then undergoes internal rotation, 1/8 of the circle. Anterior shoulder comes to lie behind the pubic symphysis. With further contraction, the posterior shoulder sweeps against the perineum, and then anterior shoulder itches against the pubic symphysis and then gets delivered, and then it undergoes restitution. Following the restitution of the shoulders, the next mechanism of delivery is the mechanism of head delivery. The engaging diameter of the head, we all know, that is a suboccipitofrontal diameter. It comes to lie in the right oblique diameter of the pelvis, and this is opposite to the engaging diameter of the shoulder and the breech. Okay. Once it engages, it undergoes internal rotation. So the occiput comes to lie behind the pubic symphysis, and then with further contraction, flexion of the head occurs, and then this occiput hitches against the pubic symphysis, and head is borne by flexion. And if you see, you will see the chin first, the face, and the vertex